Well, there are many big issues in healthcare for the United States today. The one that has the public attention is the issue of cost. But cost is really a shorthand because the bigger issue, that's the real issue behind that, is value. And I like to think of value as the relationship of the outcomes of healthcare in all their dimensions: the technical quality of care, the patient experience with care, the capacity to restore function, the health of the community, for the resources that are expended. And there was a lot of concern that with costs growing, and if you think of quality of cost as a ratio, the outcomes are not commensurately good, and we have a value problem. But if you actually get back a little further behind that, is that we have a society that is now playing catch-up ball. We're taking care of a lot of advanced disease, much of which is preventable. We have an epidemic of obesity and inactivity, leading to all sorts of adverse health consequences. And I can name 100 diseases. At the top of the list, of course, things like diabetes, but most Americans may not know that postmenopausal breast cancer, colon cancer, other GI cancers are actually increased with obesity. And so, we have two major issues. We have this issue of our sick care treatment not delivering the value that it really needs to. And we have this, frankly, larger issue of a society that's not oriented toward health, where with all the possibility, we slip across this gulf from health potential into sickness, and sickness that consumes great resources. And obviously, these are very complex issues, and one might think about them both together and separately, but just to divide them for a moment, you might say that we don't invest enough in the preventive services, in the social supports, and things like education and walking-friendly communities. It's interesting to look at aerial pictures of the United States. In much of the country, we've parsed ourselves into cul-de-sacs, and even though you're a block away from a school, a kid can't walk to school. Well, they're not getting the exercise that they might have in an earlier day. We're investing in physical education at school. So we have this big health problem. Now, why am I making such a point of this? Well, if one looks at the statistics about the cost of, or the expenditures for healthcare services, the sickest 15% require around 80% of all of the healthcare expenditures. The sickest 5% are virtually half of healthcare expenditures. And so sick care is end stage. It's interventional or it's remediation, oftentimes for things that might have been prevented. How bad is this challenge of obesity and its consequences? Well, having had some history in VA, I got to know a little bit about our armed forces. And whatever one's feelings are about our wars, I don't think most folks know that 2 out of 7 of the young adults who seek to enlist are turned away, not because they're unfit, but because they're so incredibly unfit that even the Army and the Marines don't think they can get these folks fit in a reasonable amount of time. In my current state of Tennessee, we are in the southeast, in the belt, where there is really an epidemic of obesity. I can tell you there was a large company that thought about locating to Tennessee, which would have been an economic boom to our state. They chose another part of the country because for every employee that located here, they anticipated they'd need to spend an extra $1,800 a year to combat the health consequences of this sort of social pressures toward unhealthy diet and lack of activity. This is a national competitiveness issue for the armed forces, for our state of Tennessee, and frankly in healthcare. Ironically, in healthcare, it's one of the most unfit workforces around, and that costs a lot more. So we have this big issue, this big social issue, ranging from education to structure of communities to our ability to support exercise, to our dietary choices. And while it's true that at this moment tobacco still marginally exceeds the consequences of obesity as the #1 cause of early death, disability, and disease, obesity is gaining on that rapidly. When the baby boomers were children, the rate of childhood obesity was, at the beginning of the baby boom cohort, 4%, at the end 6%. Today, the rate of childhood obesity is 21%. 21%. Today, approximately 2/3 of adults are either overweight or obese. But with our childhood obesity, in 10 to 15 years, the anticipated rates are in excess of 90%. In fact, I don't know that most people realize this, is that we've had tremendous gains in longevity. And I think many do appreciate that much of the health gain of the 20th century is not related to interventional medicine. It's related to public health and all sorts of other good things, sanitation and disease control and immunization. All of those are great things. And in fact, if you were born in the cohort of 1900, you had half a chance of not being alive by age 54. If you were born in the cohort of 1950, you had half a chance of being alive into your mid-70s. The generation of children born today are on course to experience two things. First, for children born from 2000 on, it's likely that 1 in 3, according to the Centers for Disease Control, will develop type 2 diabetes in their lifetime. Second, this current generation of children born since 2000 may be the very first in contemporary America to experience shorter longevity by as much as 5 years than their parents. And that's been published and documented a number of articles, including in the New England Journal. Pretty frightening thing. So we have a health opportunity.